the mental health side. Because I think it's been clearly shown that with autism, as early as you can diagnose and intervene, the better. However, it might be that with mental health, some mental health issues, that you should wait and hold off on medication or treatment until it presents itself as something that obstructs normal activity. I had someone suggest to me when my son was, I think before he was 3, that if I thought that he was bipolar, that I should get him diagnosed at that age. And I was quite surprised.
At 3?
Yeah.
So that's definitely too young.
Yeah. So how proactive should we be on the mental health side? And what age should we start?
Yeah, that brings up the whole issue of labeling too, right? Because the very process of labeling a child then brings in a whole sort of process from the parent's perspective in terms of how they see the child, in terms of how they might interact with the child, and so you have to kind of strike a balance. Oh, sorry, fix it later.
I'm glad you asked the question about early intervention, because I think it's absolutely foundational that the earlier you identify, the earlier you treat. That doesn't necessarily mean you have to pharmacologically treat all these kids. You are going to prevent complications. You're going to reduce the risk of complications, and you're going to improve as early as possible. Right? 3 is too early. And when you look at, part of this has to do with the natural history of when these things emerge. And they don't tend to emerge until early school years. So 6, 7, 8 is kind of like when you should start being attention. So when it comes to developmental stuff, if you have an early diagnosis and you're doing your ABA and you're doing your SLP, it's at that kind of mid-elementary grades where these other issues start to become obvious, right? What you don't want to do is wait till 12.
Perhaps I could add to that. I agree absolutely. With the 12 years old, we're beginning to say signs are clear. In my mind, it comes back to the comment that we said earlier, which is mental health is just one health issue. There's physical health. So social, emotional, and physical health need to be packaged from the very earliest years of your child. So if you're not feeding them properly, sleeping, exercising, doing all those things, there's going to be a result that happens in terms of their physical development. In terms of their emotional development, that's a whole different set of skills, strategies. And I'm just coming from education, it's by the time we begin to see those signs, man, you're playing catch up then. Yeah. Right? You got to go back. To the programs that we're working with right now, the earlier we can get them in school in terms of social, emotional, physical health, the better off we're going to be. Feed them properly, get the good sleep, get the good exercise. All those things begin to combine to develop a whole child. And we have to think of this as a whole child. When you begin to isolate, I worry about diagnosis, because once you think you've got a diagnosis, you think you've got the label, and therefore this is what you do. It's just not that simple. These children, as all human beings, are much more complex. So we need to be able to back this up. I mean, to me, it should start at 0 - 9 months. And then figure out who your team is going to be as you progress through 0 to infinity. Because it doesn't happen at a point in time. It happens over time. And it's just that, I know we want to make this clinical, and that's important. It has to be there. That's what drives our dollars, our funding in many ways. And coming from a school perspective, we look for people to be clinically diagnosed because they bring more dollars. You know? But does that mean that we know what we're supposed to be doing at that point? Absolutely not. And I've gone through the system, and I'm not saying that teachers or your district psychologists or counselors aren't doing the best. They are doing the best they possibly can, but they don't have the tools. They're not being taught to use those tools. Now, if we gave them the tools early enough, and we back this up into the preschool, into the first time you drop your child off at daycare at 1 year old, and started communicating with these people about what's going on in this child's physical, social, emotional life, and saying, these are the strategies that we're using. Let's do them together. Then I think we're going to end up with a whole child product that isn't already, if not desperate trouble, certainly moving toward desperate trouble.
Yeah, after a few years of beneficial consultations, my psychiatrist put me on antidepressants and encouraged me my independent living. Living on my own made me feel even more lonely than I was before, and the drugs masked the pain that I was in, and as I allowed myself to act in a very irresponsible manner. When I found myself in a financial ruin, I decided to move back home and my sessions with my doctor were terminated. I too agreed that maybe counseling services would be beneficial for me. For the next couple of years, I saw 4 counselors. My first counselor could not provide me with a phone number due to privacy issues. This meant she could contact me at her convenience, but I could not contact her to change an appointment due to illness. I really liked my second counselor, even though she worked out of 2 offices and my appointments were always moved around. I was devastated when she left her practice to have a baby. Her successor did not last very long as she chose to diversify in a different field. My last counselor had great difficulty in understanding me and I her. In my last session with her, I discovered that she was not in tune with her culture and she did not even know who Oprah was. I left that meeting very dejected and decided to cancel any further meetings. I do not have a budget to fund a suitable counselor, and I dread having to go through the process of finding someone else. So now I've been without counseling services for a couple of years. There are times that I feel that I could benefit from outside help. As a person with only a part-time job and being subsidized by the government, I feel that my options are limited with my small budget.
Great, I'd just like to say I've got the 2 children, one with a comorbidity condition and one with what you were referring to, classic autism. Classic autism one is 100 times easier to look after than this one with comorbidity, mental health issues. There's a dramatic difference in them, and the one with a comorbidity and social anxiety and socialization and the depression and everything that goes with that overwhelms the family when there is no effective support. And yet, my son's currently away from the ministry. Right now, the family has changed dramatically in its whole behaviour pattern, and from the experience of that comorbidity scenario, I can stand on my head and take care of my daughter and my wife, who again is also on the spectrum, and so there's the dramatic difference with a child who is in his teenager now, didn't really get the effective treatment he needed for his autism, or is 8 years old when he was diagnosed with a unknown mental health condition. So you see this, I've seen this dramatic effect within the family infrastructure, and yet looking back, it would have been great if I could have had access to somebody who could have helped with that mental health issue. So the autism is difficult enough that when it's compounded by this comorbidity, it can be very overwhelming, and that's my experience.
Can I just mention the family? So this is one of my main issues. So my son is the happiest child on earth, I think. The school is perfectly fine. There's no mental health issues. But my husband and I, we have quite often in the transition process different views.
Yes.
So our mental health family issues are deteriorating because our happy son is going his way. He has his view, I have mine, and constantly. And I see him, he's 17, that I spend so much time and effort, and I get so many emails, and I 10 or 12 per day, and you should do this, and that, fully overwhelmed, thinking, close the computer, go out, don't. I have to agree that I applied for a job back in Germany because I thought I can't take that any longer. So I wonder how everyone here, I mean, this is our mental health. What happened with our mental health? We constantly think about our kids. And this is great, we should do that, yes. What about me? Here, we are all human beings. We all have the right to feel happy. So who's helping us?
Very good point.
I would just add to that we are basically forced to do a nursing job 24 hours a day. And we don't have any choice as long as they're our children. and nobody sees what's happening, how hard that can be. I'm not saying paid or unpaid job, I'm not talking about payments, I'm just saying about constant shifts beside your regular job that you have to do to provide for the family.
I
So-
totally agree.
Yeah.
Are there families out there that have, you know, some ideas about how to cope with that? Because yes, the parents themselves are feeling a lot of stress that often is not even considered, right?
In my case, it actually took 2 years and I just became mentally burnt out. And I finally, my family physician and people said, you're done. You need to go to mental health. And I've been under doctor's care and my own medication. And unfortunately, my husband and myself separated. And since then, fortunately, my son has been doing amazing and I've been doing much better because we could not, as he was transitioning, my son's 18, going to be 19, the difficulty of learning you have to let them go. They're human beings, they're people. We're still going to be their coaches, but he cannot live in the basement with his computer by himself. And he's safe and protected, but that's not a life. And he is, whether we like it or not, allowed to live an independent, try his best to be who he is. And let that go and protect him as much as possible, but just try and learn from modeling, which I had to learn to model my own mental health, well-being, so my son could see, because that's how they learn visually when you're the parent, and so you say, yes, I need help. Teach them that everyone needs help sometime, it's okay to accept it, and now I'm better, I'm financially stable, my son is the happiest he's ever been with school, and even though it's difficult and he still doesn't understand why Dad isn't living with us anymore and why can't we just live together. He doesn't understand how that just doesn't work for us. But we're still his parents, I explained. He's part of me, your father's part of you. Biologically, I tell him it's impossible. I said, but Dad and I are from two different people. We're two different people. We're always your parents and you're always our son. That will never change. But I'm allowed to have a happy life. I'm allowed to disagree with your dad. It's my right as a human to have a happy life. And I was not happy and he chose to be happier or unhappier where he is, and I'm happy where I am, and you're with me, and we're very well. And this is, it takes time, it takes courage to say, I give up, or I'm done, and I'm done.
But there must be such a support group I would like to look for. You know, this, how can those two individuals who try to educate someone with ASD and have different views, how can we put them together? How can we solve it? And here I'm stuck. This is my one.
So I think, these are heartbreaking stories because we're no longer talking about just ASD, we're talking about your mental health, family mental health. And to me, this is the crux of this whole issue. If we're going to be proactive, if we're going to start at a very young age and deal with a child's mental health, you have to deal with the family's mental health, you have to deal with the child's mental health. And we have a large part of our population, and a growing larger part of our population, I don't know what the term would be, but they themselves haven't developed appropriately, and they're bringing up children who are challenged in different ways. So I don't think there's a simple answer to this, but our greatest success has come from the educational system when we didn't bring the parent in and said, here's what we're going to do with your child. That was a dead end, because we only get them for a certain length of time. Here's what we are going to do, you are going to do, here's what we're gonna help you with your family. Parent would say, I got 2 jobs, I can't be home doing this. Okay, well, who's ever caregiving your child, we need them in on this meeting. I wanna come back to your point, Colin, because what's the stumbling block? Privacy. That's the point. This isn't a private thing anymore, this is a very public thing, and it's a very communal thing. So when we changed our focus from being a child's issues to being the need to wrap around a family, it takes a village to raise a child. Well, who's your village? It only takes 4 or 5 adults to be able to come alongside of a family and a child and say, I'm going to take your child out for coffee every Saturday morning. Whatever, I'm going to take them to the park, whatever it might be. You know, those, Peter Benson called them sparks. In every child there's a strength. And unfortunately in our society we identify the weaknesses, we identify their deficits, identify their strengths. When we brought kids together and families together and teachers together, we didn't talk about their deficits, we talked about their strengths. We're going to build upon those strengths, and we pulled the adults in to create that network of support for the child and the family. It was to augment the strengths, not to minimize the deficits, not to say, well, this is the behavior you're going to carry on. We do have to do those things, but it wasn't our only focus. It had to be the whole child, and the whole child is made up, as the whole family is made up of strengths. You know what? It's devastating when families fall apart because of these types of mental illness. It's not the direction that we need to go. We need to go exactly the opposite. I'm Pollyanna. I believe that in our human qualities, the attachment, the sense of belonging that we have, and the care that we have for each other, is demonstrated in all of these people that are willing to come alongside of you, whether it's the professional side or the experiential side. I'll give you 2 words that we used over and again: purposeful and intentional. Once we had a purposeful and intentional plan in place that we modified every 4 weeks about what's working and what's not working, who's taking the child, who's helping the parent, who's coming alongside of who, including the team themselves. So the team of adults also needs to be held together and supported and encouraged, making them feeling the right thing. Then we tended to move in a positive direction. As long as we felt that we had a diagnosis and that meant that we had to do A, B, and C, or that this is the way my husband's going to deal with it, this is the way I'm going to deal with it, and they're at polar opposites, it's not going to work. You have to be on the same page. So we were quite happy to say to a parent who would come to the meeting and say, I've got 2 jobs. That's okay. We don't need you to do any more than that other than to say, endear us to your child. So instead of saying that stupid school doesn't know what to do with it, get on the same side. And the neighbor. Whoever else it is. I think it can be done. I just don't think we've gone down that road yet.
I think what needs to happen is as soon as a child is diagnosed with autism, there needs to be a counsellor involved to put the parents on the right path and to keep an eye on the family dynamics and everything that's going on. My husband and I were very lucky that early on we both saw counsellors and they told us that you need to look after yourself, you need to exercise, you need to go on dates, you need to, and your whole life is your child with ASD. And you know, you have a successful marriage now because of that. But you still, there's always that guilt, there's something you're missing, like you mentioned the emails, and I mean, I didn't even know about this until 2 days ago, like no one told me, like I sort it out on, I don't know, one of the emails that I get. But I mean, this is like so amazing, like all parents with ASD should be here, right? But they don't know about it because no one's telling them. You need someone central to be managing everything for them.
We believe that the school can carry that load
I
without
don't
it
think
weighing.
the school can. In
Without
my
it weighing on the
experience, the
shoulders.
school doesn't do anything.
No. So no, let me correct that because
In
I
the
don't think the
future,
school is doing it,
Yeah.
but having been in schools that have moved in that direction,
Yeah.
it can be done.
Yeah,
So
oh yeah.
we look at top down, bottom up, side in, and I think the side in is the area where can you affect the informational flow, if you like, of
Right.
where things are, who has what,
Yeah.
yada, yada,
Yeah.
all that sort of stuff.
Yeah.
That to me sits quite well within a systemic model like a school, which can absorb and, again, I'll refer back to this problem with counselors, is that they become rotational. And you get abandoned at some point, they move on, they're pregnant, they're whatever they do, and that's a frustration. But a school is enduring. I don't mean the personnel, I mean the school and its community becomes an enduring focal point.
Right.
So give up your privacy and say, you know what, we have issues.
Yeah.
My child needs me, I need you guys to help me, let's do this together. No judgments, no stigmas attached to this. Let's deal with the child together, and that will deal with you.
Yeah.
Now, I don't think schools do this yet because, you know,
No.
they say, I'm not teachers will say, we're not taking another burden onto
Yeah.
our plate.
Yeah.
You know, we've already done curriculum, and now we're doing mental health, and now we're doing, you know, all of those sorts of things we're not. So it doesn't belong to a teacher, but it can belong to a system that has the mandate to say, we will be the center of that conduit of information within your community. That doesn't mean the school has to own it even. It just means that they will identify the people that can act as the facilitator for family connection. And there has to be somebody that monitors it.
Yeah, it's just gonna take years and years and years. to set
Yeah,
it up.
but if we're not getting anywhere we're going now, we have to move in that
Yeah,
direction.
yeah, no, I agree.
I
Yeah,
believe
yeah.
it.
Okay, so this lady and then the two panel. Oh, is that what you did?
Because Asperger's syndrome is one of the most invisible of all disabilities, and we adults with ASD need continuous and ongoing support for mental health services. We find it very stressful and unnerving to be left in the lurch. Already we are lucky to get part-time and or low-paying jobs which keep our living standards below that of most of the population. That is stressful, and the perpetual rotation of new counselors or peer support workers who come and go just adds to our stress level. With most changes and needs for additional services, we have to beg the bureaucrats and fill in paperwork, and it makes us feel like third-class citizens. Individuals with autism need stability and constant people in their lives that they can depend on, and we do not function well with so much change. We need to feel that like we too have some value in society, because we are intelligent on a different level. Many of us already feel like a failure on a day-to-day basis, telling ourselves we will never amount to anything more. Unlike normal people, we are not likely to get married, have children, drive, own our own homes, and have well-paying jobs with benefits.
A lot of this talk has reminded me of when our first son was born, and we found out 3 weeks before he was born that he was going to pass away. He had hyperplastic left ventricular or something or other. His heart hadn't developed, and we fortunately found out prior to the birth, which gave us the time to think about it and go through the grieving process and be at a point where we could welcome him into the world for as long as we were going to have him, for however many hours. And I'm not doing this to start tugging on heartstrings, but the day he was diagnosed, we were assigned a lovely person named Gwen. And she was my liaison between myself and all these incredible specialists, all these white suits. And so for my husband and I going home with this devastating news, sitting there having her little phone number, I mean, I'd wake up in the morning and I'd have a question and I would phone, and she would find the answer and she'd get back to me instantly. But I was never left waiting, no matter what fear, it didn't matter what time, I could call Gwen. And she was, you know, because I don't have access to the fancy doctors, but I had access to Gwen. And over those 3 weeks, it was instrumental in helping me come to terms with what was happening. I mean, because we all know that that is not something that you can easily just come to terms with. It was our first child. And I remember visiting her afterwards, and she was just always inside me. I knew she was there. She was something I could count on. She was my rock. And so then, I mean, we had another son, and then we had Tegan. And when he was diagnosed, I looked straight to the pediatrician and I said, okay, who's my Gwen? Who's my Gwen, right? Like, you know, we get to take this one home, so this is not devastating in the same way, but it is the diagnosis of losing the child we thought you were going to have. And there is no Gwen. There's a pile of papers, and it's go home, good luck. There's nobody to tell you what the right thing is to do, because nobody knows what the right thing is to do for your son or daughter and your family. And then it's left up to us to cruise around, bump into people, well, you should try vitamin therapy, and you should do ADA, and you should do sensory integration, and you should, and of course as parents, we're like, okay, well maybe this, okay, maybe that, or maybe, and you don't know. And it really is, I think it behooves us to have a Gwen. Just have that person that can help us. And I just want to address Colin's thing on do we all talk to each other? We all do as much as we can talk to each other. I I know in Richmond, we're really proud, we have a committee specific to autism, and everybody's allowed to be on the committee, and we have an annual resource fair for all our families. And everybody who's got services or parent support groups, because we have several in Richmond, we're very fortunate, you know, but we have an ADA support group in Richmond, we have the RAPS, Autism Parent Support Group, which is more eclectic, but everybody works with everybody and shares information. So we're trying really hard in our community to make sure that the Richmond families know exactly what's going on and who to connect with, which restaurants are good, which dentists are good, you know, that type of, because that's not information you can get from a central organization, right? You can call ACT, but they don't know what's happening in our individual communities, and I think it behooves each community to stand up and do something. Thank you.
I got a few comments, I guess. One, I think your comment about the schools. When you're a parent of a child with autism, you gave up your privacy on day one. So it is not us who are not being forthcoming or letting open our lives to the schools. It is the schools who are shutting us out. I'm a parent, but I've also worked as a behavior interventionist for 15 years, and I've been to more IEP meetings than I care to admit to. But to be sitting in meetings where people say, the school is an entity, and we will do with your child what we see fit during the day, and school is a different place than home, and trying to make the argument specifically when I'm on IEP for my son, that he's the same person who got up in the morning in his bedroom that he is when he arrives at school, and so he needs consistency. So that's not happening. And I do think the schools are overwhelmed, and they can't do more than they're doing. I think that the ACT service provider list, I think back to when we're an ABA family, we looked on the internet 18 years ago, because there was nothing. There was no early diagnosis. Treatment, yes, there was no early diagnosis program. No one would see him at Sunny until he was 5, but you got to have that diagnosis before you get into school. There'll be no services. You know, I found out about ABA because a friend of mine who's a preschool teacher took an art class, and the instructor was talking about how great it was that this boy was in her preschool and making these great strides, and she got a name of a phone number from a woman, and that is not how to find services for your child. But it worked out. When I'm talking about early intervention and the question the gentleman was saying before about, you know, should you give a 3-year-old meds? When I say letting people have access or letting them know about mental health earlier, I don't mean start medicating children at an earlier age, but what I'm saying is the one thing about the ACT list, as an example, is you can find a service provider. You go to a social worker and you're asked to fill out a form, and it does feel like it did at that time, I don't know what it feels like now, to fill out forms for whatever funding is available and get on whatever wait list, and then you're sent home. And my social workers have always, and particularly the one I have now is fantastic. I don't know how she finds the time for me, but they have enough to do in the day and huge caseloads. But I think if we give people the broad strokes, there is a specific treatment for everyone. You know, the doctor was saying everybody's different and everyone requires treatment. But parents aren't being given broad strokes in the beginning. They need to know that they should. I don't want a counselor assigned to my family. I find it difficult enough having to have dealt with the same ministry office that deals with children who abuse their kids and being asked to prove who I am and be given an ID. That didn't help my mental health. So that in case I want to harm my social worker. But being told that there's behavior, I don't want a social worker to tell me what behaviorist I'm supposed to use for my son, but I want to know that behaviorism is out there and it can be effective. I don't want to be given necessarily the psychiatrist, but I want a service providers list of people who can help. For our family, he's functionally nonverbal, severely mentally retarded. Not every psychiatrist even knows how to address him, let alone treat him. But there are those, and it took longer to find them than it should have. If I want a counseling service, if I want marriage counseling, there are professionals who will deal specifically with that. The lady was talking about if you can't decide between you and your spouse who's right, sometimes it's because you're so burnt out. And you, looking at, you know, building families as a whole, you can't access services because one, your child's behaviors or deficits don't allow them to be treated by, say, the average family doctor or even psychiatrist or specialist. And as a family, you can't leave the house. Right, so let's go for counseling services. Well, my son didn't sleep more than an hour and a half to 3 hours a day, 2.5 years. There wasn't a lot of leaving the house. Right. So, anyway, that's my comment.
Can I speak as a parent of a child with autism and as a trained social worker? So I have a master's degree in social work. I have a very high regard for social workers and the field, but it is a complete misfit to have social work taking on what is a medical issue. Our children have a neurological condition. They require a medical diagnosis. We are sent to social workers, however well-meaning they may be, to be essentially gatekeepers for doling out medical treatment. And so I as a mom who's gone through the system and as someone who has had X number of years post-secondary in the field and working in hospital settings and mental health clinics and things like that, I just don't get how this happened. It just makes no sense to me. And I want to say thank you to the two mothers who told those stories. I hear those stories over and over again. I can relate to those stories very much. I found Gwen. I found lots of Gwens, but I have found them through other parents who get it. Those are my Gwens, and I have at least 6, 8 really close Gwens in my life that have been there now for 8 years. Those are the people that I go to when my mental health is going down the tubes. I need to talk to another parent who gets what I'm going through, who is going to share whatever information they have with me, and who I can take my kid when he's acting crazy to their house in their backyard, and when he's doing whatever. You should have been there during the toilet training years. I won't go into it now. That's how you know you've got a Gwen in your corner, when you can take your kid around their house. And that is part of how the ABA support network developed. Is we were just a group of moms basically saying, like, we're all going to be drinking way too much wine and doing really stupid things, and we're getting angry at our husbands, and our houses are disasters, our worlds are shrinking, our other support networks, our other friends, they start dropping off. Your world, your environment gets smaller and smaller. And that is what we decided in part to do, was get our community together. And it started with just a small group of us, but now we have communities, neighborhood networks going on in other parts of the Lower Mainland, because we realized this is what parents were asking for. And it's expanded beyond that. So now it's support, but it's also information. We provide seminars and things like that. So I'm giving a bit of a plug for the ABA support network, but part of that is, as a mom and as a social worker who used to help deliver those services, I just kind of think that's where a lot of us need to go to get the best support we can.
People with ASD need specialized support to help us with their issues. We could benefit from regular appointments with counselors or with peer support workers to help us function better on a social level. Many of my peers have had adverse reactions to the use of medications, and that many doctors prescribe as a first and foremost tool for treatment. We feel that we are not being listened to, nor understood, even though we try to communicate the effects of the drugs to our healthcare providers.
And that actually links very nicely to this next question from the emails I sent in. Unique mental health presentations of people on the spectrum, or people on the spectrum have unique mental health presentations. Mental health professionals typically are not aware or sensitive to how ASD affects the presentation, treatment, and trajectory of mental illness. I guess it was more of a statement, but is there something in the comment on that?
Well, it's true. I think it's changing, but it's slowly changing. I think, as I was saying earlier, I think it's incremental, and I think there's increasing awareness on both sectors of mental health, both having to bridge over and be more aware of development in the population we're working with, and similarly with special needs workers, understanding of the mental health issues there. The science isn't very good either. Most of the science is based on in terms of mental health and psychiatric disorders, is based on what we call, if you call it, neurotypicals. And there's a little bit of research around the edges that's being done on how do these things present in other situations in autism and intellectual disability, but it's still not the mainstay of research. So we're a lot of us are learning on our own. We're learning as we practice. I wasn't trained in this area. It wasn't something that I wanted training or had anybody who knew how to train us in this. So it's been a lot of self-taught. So we're at an earlier stage, I think, still in terms of understanding that. But I think we're starting to.
There is a,
Sorry, there's a question for Tara.
Mhm.
Speaking about, for personally, your own mental health and your struggles with it, my son as well has had those issues. And what has worked best for you personally? Is it talk therapy? Some people use yoga, or is it medication for yourself?
Needlework.
Excellent.
I belong to the Vancouver Guild of Embroiderers.
Excellent. I think that's
I
an
don't
excellent.
believe in medication, except for specific medical issues, and I don't think I don't think medication for depression is good for you. I mean, I think it helped to trigger my lymphedema, and my legs got like really big. So, and most of the time you're prescribed like on a really high dose and the lowest dose. And there's this book I read many years ago that somebody had